Hi, I'm Brittany DeGraff, and I'll be doing the epicondylopathy tests. So the first test we're going to do is the passive test. So that means I'm going to put her through a range of motion. She's not going to do it. So I'm going to bring her hand towards her forearm. And if there's any pain, that is a positive test for epicondylopathy, lateral epicondylopathy, or tendinopathy. So the next one is active. I'm going to put my hand behind her, and I'm going to have her resist it. A positive test is pain, and that's for lateral epicondylopathy and tendinopathy. So the next two are medial. So for the medial, I am going to do the passive. I'm going to move her hand back for her. If there's any pain, that is a positive test for medial epicondylopathy and tendinopathy. And this time she'll push or resist my push. And that is for medial epicondylopathy or tendinopathy, which pain is a positive test.
Hi, I'm Adrian. I'm going to be doing the valgus and the varus stress test first, which test for laxity. So for the valgus stress test, you're going to want to put the stress on the MCL, so you're going to go like that. And then for the varus stress test, you're going to want to put the stress on the LCL. So that is laxity, so you'll want to do that one bilaterally, so you'll do it on the other arm, and yeah. And the injuries for that, for the valgus one is an MCL injury, and then for the varus is an LCL injury. The next one is the elbow flexion test, so you will have your patient put her arms to her chest and then hands out like this, and then wait for like 5 minutes, or if she starts to feel paresthesia before that, then you can stop, and that would be a positive test. And this would mean that there is ulnar nerve entrapment or compression. The next tests are the radial and ulnar collateral stress tests. So just like the varus and the valgus stress test, you're going to do that except for on the ulnar collateral ligament and the radial collateral ligament. So you'll just put the stress on that ligament and then stress on the opposite ligament. And then positive test for that would be pain or laxity. So for laxity, you do bilaterally, and that would equal radial collateral ligament sprain or an ulnar collateral ligament sprain.
I'm Sarah Dudley, and the first test I'm going to be doing is the balance test. So for this one, I'm going to instruct the patient to put your wrists together like this, and then drop your elbows, and then you're going to hold that for about a minute. And a positive test would be paresthesia, and that would indicate carpal tunnel syndrome. The next one is Eccleston's test, and for this one, I'm going to have her put her thumb in like this, cup her thumb, and then push down. And if she has any reproduction of symptoms, that would be a positive test, and that would indicate de Quervain syndrome. For the next test, that's the varus and valgus stress test of the fingers. So for this one, I am going to put so for the valgus one, you're going to put a lateral force on, and that would indicate an MCL sprain of the finger. And then the varus, you're going to put a medial force on, that would indicate an LCL sprain of the finger. So a positive test for that would be laxity, so you'd have to do that one bilaterally. And the last test is the trigger finger test. So for this one, I'm going to have her just bring her fingers to her palms like this. Nice. And if there's a painful nodule or finger lock, that would be a positive test, and that would indicate the flexor tensosynovitis.